We want to start tonight with at-home testing because we know a lot of you are planning on using those tests ahead of any get-togethers for the holidays, to the point where they're actually getting hard for some people to find. It's something that's been in the news a lot recently, with the White House announcing this week that 500 million tests are going out to Americans. New York State planning to send them home with kids, and there is even a request in Erie County to make them available to every county resident. But people do have a lot of questions about them, and we want to get you answers tonight. And we are joined by Dr. Timothy Murphy, Senior Associate Dean for Clinical and Translational Research at UB's Jacobs School of Medicine. And Dr. Murphy, we're glad you're with us, and we want to start with the three questions we are hearing the most. People wonder how accurate these at-home tests are, how they compare with the tests done in a lab, and there's also a concern about how to know when to choose one method over the other. So I know it's kind of a lot to begin with, but what do we need to know here?
Thanks, happy to be here. So at-home tests can be a useful tool and add another layer of protection for us if they're used correctly. A positive test means that it's highly likely that you have the virus. So if you get a positive at-home test, you should isolate and contact your provider. A negative test does not necessarily rule out that you have the virus. So that's called a false negative. When you have you can have a negative test and you may not have the virus. So in that circumstance, what you should do if you're having symptoms, then you should get a laboratory-based test. One way to make a negative at-home test more accurate is if you have several tests that are negative 24 hours apart, then that reduces the likelihood of a false negative test.
We know there are a few different at-home tests out there on the market. Is there any reason to choose one over another? What should we be looking out for?
There are 16 at-home tests that have received emergency use authorization by the FDA. So it's a complicated situation out there. I'll give you several pieces of advice then. One is I would make sure that it does indeed have emergency use authorization. You can tell that from the package, or if you're ordering them online, you can do your research there. For what it's worth, Binax Now rapid antigen test accounts for about 75% of sales in the United States. Make sure that it is a rapid test and not a home collection kit. They're often sold together. And a home collection kit, I mean, if you want that, that's fine. But if you're looking for a rapid test, you don't want a home collection test, because that you have to send your test in to a laboratory to have it tested. And then there are 3 tests that are approved for children. So if you want to use this on children, just make sure that you use one of those 3 tests. If you're not sure about these things, you can ask your pharmacist, and then you can do your online research when you're ordering them, if you're ordering online.
One of the other things I heard you mention is that if it's taken correctly. So we want to ask you about that. If we've been traveling, or you want to make the best effort to make sure that you're negative before a family Christmas party, things like that, what is the best way to actually use these tests, particularly for those situations? For example, how many should you plan to take? When's the best time to take them? What are some of the issues that people should know about as far as that goes?
Yes. So I would say also that the safest way to have a family party is everyone there is vaccinated and boosted, who's eligible for boosting. What's the best way to use the test? So really the best way to use the test would be to do them daily for a couple of days before your get together, and do the last one immediately or within hours of when you go into the event. If that can get expensive, it can get unwieldy, it can get unrealistic sometimes, in which case the most important one is that test that you do right before you go in to the event. Some people actually do it in their car in the driveway before they go into their family member's home.
And there have also been some calls basically to do what's been done in parts of Europe, which is to send these tests to everyone who wants one for free. The argument there is that it allows people who have COVID to know earlier. Hopefully they can avoid infecting other people. Do you think that's something that could be effective here in the U.S. or even on a smaller scale, like somewhere like Erie County?
Having widespread tests available at no cost is important. It's critical, I think. It'll help us end the pandemic. That's what, for example, let's think about tests to stay for kids. So the idea is you test every child, and if they're negative, they can go to school. If we had enough tests, we could do tests to stay at work. We could do it for healthcare workers. We could use these tests strategically if we had them available and they were in low cost. So I am strongly in favor of more widespread testing.
And before you go, we wanted to get your perspective on something else here. We reported first at 5 that the FDA has now approved Pfizer's antiviral pill as the first oral treatment against COVID. How significant is that in the overall fight in this pandemic?
Yes, this is a significant advance. So Paxlovid is an antiviral agent, so it stops replication of the virus. And in the clinical trial done by Pfizer, it reduced hospitalization and death by 88%. There are currently 140,000 new infections daily in the United States. So a significant number of those are going to have bad outcomes, requiring hospitalizations and so forth. And so those are the things that this drug can treat and prevent. And the people who will benefit most are the elderly and those with underlying illnesses who are vulnerable for adverse outcomes and worse outcomes.
And Dr. Murphy, it kind of goes back to what you said when we started this conversation, when you talked about the layered approach and how important that is overall.
Yes. So we have vaccines, we have masks. Those are absolutely critical. We should be wearing masks when we're in public places, particularly in indoor public places. We have testing now. We should have more widespread testing, and that's going to help. In the home parties, ventilation is important as well to reduce the spread. So all of these things contribute to our ability, to the tools that we have to reduce transmission of this virus and bring the pandemic to an end.
And we have had so many questions about this. So Dr. Timothy Murphy, we so appreciate your time. He's the Senior Associate Dean for Clinical and Translational Research at UB's Jacobs School of Medicine and has been a guest for us tonight on the Town Hall. Thanks again for being here.
Nice to be with you.